We have a great episode for you today where I talk to Dr. Tracy McCarthy about the benefits of functional medicine for getting to the root cause of all of your midlife health concerns. We talk about how focusing on giving the body what it needs, whole foods, an anti-inflammatory diet, and getting the junk and the toxins out of your life can really enable the body to heal, even from some of the most serious health concerns. She gives us some of the big rocks we need to focus on, as well as some of the baseline supplements that most of us need. If you love this topic, head over to our website, insightsfromthecouch.org, and check out our download that will include my list of favorite books and resources for becoming your own health advocate and kickstarting your wellness journey. I am solo today with Dr. Tracy McCarthy. I am so excited to bring her to you guys. She is a functional medicine doctor and also a trained psychiatrist. So we are going to hit today that intersection of the mind and the body from a functional medicine approach. Welcome. Thank you so much for being here.
Thank you. It's a pleasure to be here.
So we were talking just a little briefly, and you said, there's a way you got into this space. So I'm just so curious, what drew you to functional medicine?
Yeah, I definitely did not start here. So I went into medical school really excited to learn about what goes wrong in the human body, what causes illness, how do we fix that? And the first few years of medical school were really, satisfying to me that way, learning a lot of pathophysiology. But then as my training progressed, it became more and more about matching symptom patterns to a diagnosis, which of course makes sense, but then matching that to a pharmaceutical. And often the conversation would really end there. And I was left still often asking, well, why do people get schizophrenia? Why do they get bipolar? This is, as in my training as a psychiatrist. And often it was like, well, we don't really know. End of conversation. And that was frustrating. But, I went on in my training and was using all these tools that I had been taught. But what I really saw was patients becoming so frustrated with, the limitations of these tools. So medications that are, have a lot of side effects sometimes, or only partially treat symptoms, or patients would ask me, am I going to need to take this for the rest of my life? And it felt like there was more to it that we were not looking at. And around this time that I was getting more frustrated, I was fortunate to really stumble upon the research on chronic inflammation and the role it plays in really everything. And how we can really influence that chronic inflammation with nutritional and lifestyle changes. And I started just exploring this on my own. It was like a hobby, changing my nutrition and seeing how I felt, and then just getting so excited about what I was learning and hearing about people, for example, with autoimmune disease, having reduced symptoms or going into remission, something I'd never learned in medical school. And I just couldn't go back from that. And so I fortunately found the Institute for Functional Medicine and started training in this approach, using, these tools in practice and finding other doctors who thought similarly, which was really wonderful for me. And then really starting to wonder, can I apply this in mental health? Because I hadn't seen a lot of examples of that. But over time I did. And I realized what you realize as you train in functional medicine, that, geez, everything causes everything. So yes, in some people, this is going to manifest as a mental health problem. And someone else, it might be an autoimmune condition or might be, gut issue. So I was able to train and then realized I needed to actually start a private practice to implement what I was learning, because I was an inpatient psychiatrist. So working with hospitalized psychiatric patients where I couldn't influence what they ate or really much of anything. Fast forward to where I am now, so exciting. Just so grateful, really, because I get to partner with wonderful patients and empower them, educate them about what's going on in their body, and see them make dramatic improvements in a way that's, not just limited to a single tool like a medication.
Wow. And I feel like and you tell me, but I feel like finally the zeitgeist is here where people are understanding, that functional medicine or root cause medicine is where we need to be or needed to be all along. And it's finally getting its day. The whole Good Energy book by, what is it? Casey Means.
Mm-hmm.
It's just finally, I think, everywhere. Does it feel the same to you?
It's a little hard for me to see it because I've been in it so long, but
Yeah.
it does always feel like it's growing. And, I certainly hope that's the case, that it's that we're at a kind of inflection point because, our approach for chronic illness in the conventional medicine world has not been working. It doesn't work.
It does not work.
These are multifactorial problems and they need a multifactorial approach. So I'm excited that seems to be the case, and that certainly that the movement is growing.
Yeah, I'm excited too. And as somebody who's been watching it, I feel like it is. It's finally, and I hear about it constantly, even in my own practice. People are bringing it in. So I think that's a great sign.
Mm-hmm. That's good news.
So right now, are you, with your practice, are you taking like an internal medicine approach? Like, are you helping people with all kinds of things, or do people come to you mainly for psychiatric concerns?
I have a blend of both.
Okay.
Often people are looking for someone who can do that combination of psychiatry and functional medicine, or look at their psychiatric issues from a mental health point, from a functional medicine point of view. However, usually people have a multitude of issues, and even people who are coming primarily for example, a gut issue, usually have concurrent anxiety or depression. I mean, these things go together. So it's a blend. Yeah.
So tell me, like, our audience is the midlife woman. What do you see coming into your office as like the archetypal midlife client, patient that you see?
Yeah. I mean, I see a lot of hormonal imbalance, triggering brain fog, fatigue, and then we see a lot of gut issues. And these are all interwoven. It's not only caused by hormonal balance, it's everything together. But usually it's a combination of gut issues, fatigue, and some kind of brain issue like anxiety or brain fog or mood issues.
Yeah. Yeah. And it's, I feel like, and I was just thinking about this the other day, is no matter where I start with a client, whether they're coming in because they have anxiety or they come in because they've got a health concern, because I see a lot of health anxiety too. And then, or just they're going through like a horrible breakup. We always wind back to their bodies and the way they feel about their bodies. And that the midlife woman is concerned about the intersection between her own health. She's probably seen, a parent get in decline or die. Mm-hmm. She's worried about her own viability as a sexual being. Mm-hmm. She's maybe experiencing all kinds of high blood pressure, high cholesterol for the first time. So the body is such this like place where she wants to make lots of habit change and is very curious. So I feel like every single one of my clients would want to go through meeting with you and doing a functional medicine approach. Tell me, like, what does that journey look like? What's the process you take a person through?
Yeah, great question. So it's really a process of detective work and casting a broad net to look for the various contributing factors. So I mentioned this earlier, but really chronic conditions have multiple causes, and they're not the exact same cluster of causes in any one individual. So you've got to look broadly. So the initial assessment, it's a long history taking. We really detail about the patient's whole health journey from the beginning. What were the exposures in utero and as a child, and on and on, because it all contributes. And then looking at, really wide array of test results. So as a basic level, I'm going to do a broad blood panel that's going to look at inflammatory markers, nutritional markers, hormone levels, et cetera. And then also a stool test evaluating the health of the gut, looking at digestion and the microbiome, which is, the bacteria that we have in us. Is there infection there? And then also something called the urinary organic acids test, which tells us more about the gut, about detoxification, about the health of the mitochondria. You mentioned good energy, focuses on that. So when we get that array of test results, we're really able to look at, okay, here's the areas of imbalance. There is a bacterial imbalance in the gut. There is a problem with blood sugar regulation, for example. There is a toxic issue. Maybe there's a mold exposure. So these are we'll find the cluster of contributing factors that are important in that person's particular case, and then prioritize treatment from there. And treatment has a lot of components. So That's going to be nutritional changes, depending on what we found. It's going to be lifestyle changes. And it's also going to mean, fixing what's missing. So with food, and often supplements are very important for that. Sometimes we even have to use medications to treat some type of overgrowth or something. It's a mix of things. It's really that combination of treatments that gets a person forward faster to their goal.
And how does that contrast from the conventional medicine approach? That's pretty thorough what you described.
Yeah. Unfortunately, it's very different. So most of my patients' experience has been going to the doctor with their symptoms, being told that their, quote, labs are normal, end quote, which is really just usually very, very basic labs, which would never show what we're talking about. And often feeling very dismissed, sometimes, even being told it's essentially in their head, sometimes being offered something like an antidepressant, but often there's nothing else to be done. And they feel stuck. The problem is that a lot of the problems I'm addressing and the root causes I'm addressing are not things that are in the toolbox of conventional medicine. So, they are going to use the tools they have and what they've been trained to do. And in the very small time allotted to them. These are well-meaning practitioners, but it's just a very limited approach and a system that's pretty broken. So there's just not the room for the longer conversations, the investigation, and there's not the, awareness about how these underlying causes contribute. I'll just share with you, classes I took in medical school that I thought I just have to learn this and get through this. Some of them, like biochemistry, for example, or lately I've been thinking about this with hematology and what we call the clotting cascade. Things I just didn't need to really remember later. When I got into functional medicine, these have become critically important. And I see how they manifest every day, like different biochemical pathways with different genetics. And, that's the kind of thing we are manipulating with our supportive treatments. So it's like out of mind in the conventional medical world. And because it wasn't taught right. It wasn't taught how it's applied to patients. And now I see that. And so now I use it and I'm aware. So it's just a very, very different mindset.
Yeah, it is a different mindset. And does it require patients to be their own advocates in a new way? It's especially navigating conventional medicine. It's like you have to be an educated consumer.
You definitely have to advocate for yourself in the conventional world, or you're not going to, get what you need. But I would say that it requires patients to be a participant at a new, higher level.
Yes.
If you're looking for someone to give you the pill that's going to solve it, functional medicine is not for you, because you're going to be solving it with a guide. Somebody helping you point in the right direction and prescribe treatments.
I love how you put it that way.
Yeah,
you're going to be solving it with a guide. Mm-hmm. That's it, right?
Mm-hmm.
It isn't going to be somebody's going to hand you a script and it's going to be fine.
No, there will be work. And also I can recommend, treatments till the cows come home, but, the patient actually has to take it. So in the end, they're in the driver's seat. But I find that it's a lovely partnership. And, they really engaged patients are so wonderful to work with. They bring me ideas, and I learn so much from that work together. So it's just a very satisfying way to practice medicine.
I can imagine. So let's just break it down. Tell me about that we talk about inflammation as being sort of the cause of all disease. Explain to us what inflammation is and how it harms our body in a multitude of ways.
Yeah. So when we are talking about inflammation in this negative way, we're talking about chronic inflammation.
Yeah.
So acute or short-term inflammation, that's critical. Like when you get an infection or an injury, you want the body's inflammatory response because that's the healing response. The problem comes when we have this sort of simmering fire of inflammation all the time because of various triggers that we are exposed to, like toxins or microbiome imbalances or, food, for example, nutrient deficiencies. This can trigger this ongoing response from the body. And when we are, you're going to think about it like a battle, like there's going to be a lot of collateral damage from this inflammation. It's not resolving appropriately. And, when we're in that state, we're not in a real repair, increasing our organ reserve, resilient kind of place. We're in much more of a battle, fight or flight kind of situation. And so we're not restoring health. We're kind of in a stuck place.
So what are the signs that you might have a lot of inflammation going on in your body?
Well, I would say it's really any kind of chronic symptom that's not resolving. This can be, things like bloating or fatigue or, um, depression for sure, skin rashes, that you can, a whole list, because anything that's not kind of resolving, there's something going on that's causing it. I mean, that's the fundamental thing. There is a cause or multiple causes that, are at play.
Yeah. And then figuring out what's causing that and beginning to bring it down. Is it always obvious or can it be quite nuanced what's driving inflammation in the
Oh, yeah.
body?
It can be very difficult to find out, actually. And sometimes we don't even know for sure, but the goal is to get the body's systems working right so it can handle whatever the issue is. So let's say, for example, it's a toxin. We don't know what it is. But when we support the natural detoxification processes in the body, like, all the nutrients the liver needs to do its phase 1 and phase 2 biochemistry, detoxification steps, when we support the gut in excretion and the kidneys in excretion, we make sure we're not putting in a lot of toxins. We're making sure we're eating in a clean way and our water and our air is clean. The body's going to make a lot of progress on whatever that toxic burden is. So we don't necessarily have to know exactly what it is.
We can
It's
just
always satisfying.
activate the body's own abilities to heal.
Yeah, that's really what we're always doing, is trying to harness the thing the body's already trying to do. We just have to give it what it needs and get out of its way where we're blocking it.
Yeah, I think it's like really important to say because I think that that's the piece people need to understand is the body is very wise.
Mm-hmm.
And that if you do get out of its way and you just allow some of these natural processes to work, the body can heal and heal very quickly, right?
Yeah, it's really remarkable, miraculous what the body can do.
Can you tell me about a case or just something that you've seen in your practice that it's like, wow, that sort of demonstrates this power to heal?
Let me give you sort of a classical case of, where we did several things and then it moved the needle.
Yeah.
I'll give you a case early from my practice of a woman who had real severe anxiety. She was actually on an antidepressant and anxiety medication, which had partially treated things, but she was still having panic attacks. And she also had irritable bowel syndrome with diarrhea. So she was always never knowing when she had to get to the next bathroom. And this was totally impairing her ability to live her life. She used to love to travel and she just couldn't do these things anymore between the panic and the bathroom needs. So when I worked with her, we quickly discovered in her history that there was a key piece of information that she'd had her gallbladder removed a number of years before. And therefore really had not been eating enough fat and not absorbing the fat soluble vitamins that are so important. We could really trace a lot of the symptoms to coming maybe a year after that happened. And, the evaluation of her gut showed imbalances like overgrowth of yeast and some bacteria. And we saw certain nutrient deficiencies. And all we did was address these things. And in a few months, the diarrhea was gone. The panic was gone. She was flying on airplanes again, living her life. And it was just about, okay, let's identify these different pieces. Let's improve her digestion. Let's help her nervous system. It's just doing all the things together add up. And then the body is like, oh, now I can do what I'm trying to do.
As you're telling that story, I mean, that kind of client could have come to me and we could have, this is where I get frightened a little bit about the lack of ability to tweeze out what's going on with a patient. Mm-hmm. Is that we may never get to that biological place. I may treat her from a perspective of trauma or a behavioral approach of let's deal with anxiety from an exposure perspective. Mm-hmm. And having sort of the intuition or even just the knowledge of like, hey, you really need to go and see what biological pieces are at play here. Because very often there is that piece, right?
Yeah. And that's what I feel so strongly about. As a psychiatrist, I absolutely know and see all the time how people need to work on their trauma and learn, behavioral approaches that we need these tools in life all the time.
Yeah.
But it does make me crazy that we are missing, overlooking all of these pieces. All the therapy in the world is not going to correct someone's B12 deficiency. And that's always what I think about. It's like, we need all of these parts together. Yeah. And that's the missing link to me, is like that, these overlooked physical components.
Yeah, it drives me nuts too. And I see it more and more as I practice. And when you get the felt sense that there is really something biologically going on with somebody, and it is not just that, they have trauma. So
Mm-hmm.
that's like even more empowering for me to begin to refer people to places and know that you exist, to say, hey, because you never
Yes.
know when you're referring out, if they're going to just get sent, down some weird rabbit hole or just get another medication. But what you really want is this holistic approach of, hey, you got your gallbladder out, and that really changed how, you're absorbing vitamins. And that's really playing into how anxiety is showing up for you.
Yeah, exactly. Unfortunately, there's more and more functional medicine psychiatrists being trained. There's more like fellowship programs for this, for further, not like a board certified type fellowship, but additional certifications and trainings for people who are looking. And I feel like that's really growing. So I'm hopeful.
It cannot happen quickly enough.
No, agreed.
It really cannot
We're in a
happen quickly enough.
crisis. I mean, people are suffering.
People really are. And the more we can have these people, like have this process available for people, the quicker they can get well and healthy. So there's so many pieces to this. Like obviously the gut microbiome is a huge thing that you hear about all the time. And to explain to the listener, like why the gut microbiome is such a starting place, or maybe it isn't the starting place, but one of the places we begin.
Yeah, it's definitely a huge
health.
factor. Yeah, it can make an enormous difference. So it's often a very good place to start. Well, so the gut has a lot of jobs. First of all, digestion and absorption of nutrients, which is actually no joke. Lots and lots of people I see are not absorbing things properly. So that right there, even if they're eating a really nutrient dense, healthy, anti-inflammatory diet, a lot of it can be passing through, and that's not good. So there's that aspect of it. Then the microbiome, that's the bacteria and fungi and viruses and sometimes even parasites living in our on and in our body. And the majority of that is in the large intestine. It actually weighs a couple pounds if you add it all up. And, it's really, they do a lot of jobs for us. We co-evolved with these guys. And so they are making all kinds of neurotransmitters. They're helping detoxify. They are a key player, and they're making different compounds that are signaling our immune system whether to turn up inflammation or to turn it down. So we're interacting all the time. They make compounds that are absorbed into the bloodstream that then go to the brain and the rest of the body. They also make compounds that travel up the vagus nerve to the brain.
The vagus nerve.
Yeah. There's this thing called chemotaxis where chemicals can actually go up the nerve. So, and then of course the brain and the nerve are communicating with the gut. So it's this two-way communication that's really, really, really important. So that is a very important place to start. When we get things working right in the gut and the microbiome balanced and, the nervous system in a calm place, so the gut is working right, that rest and digest mode and not the fight or flight mode, we can see some big changes.
So what is like the leaky gut? When people say you have a leaky gut, what does that mean?
Yeah, that does have a scientific term, which is increased intestinal permeability. Mm-hmm. It's a real thing. It's not this. Yeah, I think in the 80s, people would talk about leaky gut and everyone would roll their eyes that that's just, some alternative nonsense. But there are thousands upon thousands of research papers about this increased intestinal permeability. Very well documented, known thing. And many things will increase that porosity, that openness of the gut. So if you think about what the gut's supposed to do, it's got to decide what it lets into your body and what it doesn't. It's like, I tell people we're like a donut. The gut is the hole in the middle of the donut. That's still kind of the outside of our body. And so it's this thin lining that has a very important job. And there's a degree of permeability there so that it can absorb nutrients and, bring across the right components, but keep out what we don't want. And these cells are locked together like bricks with mortar. You can think about it that way. And that mortar can open up, and that's leaky gut, where there's spaces between the cells, and now different proteins, parts of food or components of bacteria or toxins can enter from the inside of the gut in across there between the cells into the bloodstream. When your bloodstream is highly monitored by your immune system, and it's trying to make sure nothing bad gets in. So if something does enter like that, it's going to react. It's going to cause inflammation. That's that attack. It's trying to protect you. it might form antibodies to some of those substances. And unfortunately, sometimes those antibodies will cross-react with your own tissue in something called molecular mimicry. And that's when people get an autoimmune disease. So this gut leakiness is
It's no
really, really
joke.
important. Yeah, exactly.
So, and women are so much more likely to be diagnosed with autoimmune diseases.
That's right.
Why is that? Do you have an instinct around that?
I don't have a quick answer for that. It is complex, and other people are, I think, a little more of an expert in that than I am. But I think there's a hormonal aspect.
Yeah.
There's probably the issue of tolerance and pregnancy. There's a lot of components there. And
Yeah.
then I wouldn't be shocked to also see there's some societal stress aspects too.
Right. No, I think that's the work of Gabor Mate is always talking about women and caregiving and or caregivers in general and how that really depletes the body. And a lot of people can have autoimmune diseases. Yeah. So the gut is a key piece. Detoxification. I feel like the more I study this stuff, I'm inundated with, oh, wow. Like I need to change the water I'm drinking. I need to get aluminum foil out of my house. I need to, like, I mean, is there no end to what you can do to intervene here? Or is there a way to think about this in a more simplistic way?
I think that's a great topic because that can quickly become very, very stressful. And then that's
Yeah.
working against what we're trying to do. So when I work with people on this topic, I really focus on doing the things that are easily within your control and starting with always baby stepping your way. So it's sort of like, what's the most important thing? You know, what if you're eating a lot of junk food, that's where we would start, you know.
Okay.
When
Junk food is like first thing to go.
Yeah. And, you know, again, we baby step our way through that too. You know, where are people at? Can they cook or not? You know, it's just one step at a time that's doable and sustainable so habits can be built. You know, and with water, sometimes we can just easily get just a carbon filter pitcher, like a Brita filter in the fridge. That's going to still help, you know, and then over time you can keep improving these things and it's a matter of seeing what the big issues are. I mean, if you're living in a moldy home, that takes priority over everything.
Yeah.
So it just depends on the case. And, you know, it is a journey. You get more and more aware of these things, right? Like you're mentioning the foil. I mean, I remember when I got rid of all the Teflon pans, you know, many years ago. But things like that, you know, not microwaving in plastic, right? These are the things that are great places to start. But the trick is have grace with yourself. Do not expect that you're going to change everything at once. Don't try to do that. That will make you so stressed out that will backfire and make you sicker. The stress is a huge one. So you want to manage it. So, and knowing that we can't control lots of things in our environment. So just trying to focus on the things we can and then focus on our ability to detoxify what we can't.
Yeah, that's a really great point because this can become this like another thing to stress over and become fixated on and obsessive about. And really, it is such a long-term journey where you make just one sustainable change after another.
That's exactly right.
If we're talking to someone who's ready to kind of do, I mean, sort of an overhaul on health, what are the big rocks? Like where would you suggest somebody listening to start? Besides junk, after they've gotten like the junk food, what is the anti-inflammatory diet or way of living?
Yeah. So I do think nutrition is a huge place to start and there's a lot of parts to it. Also basic things like sleep and movement. Can't discount those. Those are really critical. But when we talk about an anti-inflammatory diet, we're talking about removing the things that we know are inflammatory to everybody. So that's the really, really processed foods because of the type of carbohydrates in there and also the bad fats that are in there. And just replacing those with more whole foods, things that are the healthy fats and clean sources of protein and more fiber. Basic things like that are a place to start. Of course, some people are reacting to certain foods that are inflammatory to them that aren't necessarily inflammatory to everybody. You know, they may have a reaction to, say, dairy. So that's where it gets more nuanced. But starting with the basics, like less processed food, more whole foods is a fabulous place to start.
Yeah, it's just an easy first principles. Like if it was grown in the ground, start there.
Yeah.
Right.
And of course there's nuances for people. Like some people really need to be lower carbohydrate, you know, some people do great with with cruciferous vegetables. Some people don't tolerate them. There's all kinds of
Yeah.
things that can happen, but just starting with removing the junk and putting in like real foods, excellent beginning.
Right. And where do you come down on like sources of protein? When you say a clean source of protein, I mean, I know this is like an endless discussion, but are you a fan of meat and in a balanced diet?
Yeah, I am when it's sourced well. Like
Yeah.
grass-fed beef is ideal, better for, much different health profile for us and for the animal and environmentally as well. And I'm definitely supportive of an omnivore approach because we see that there's so many nutrients that are much, much more bioavailable in meat. And I think that's really important. But you can be choosing a lot of meat that's very inflammatory if you're having the kind of conventionally raised meat. So being aware of that, wild caught fish is a really great addition. That's another one where you can get more and more, refined. But I do think a broad diet is important.
Yeah. I was just listening to somebody on the internet and they were talking about mechanics first and then consistency. And then you begin to optimize, right? So it's like if you can just get these basics, like more whole foods, then just constantly, and if you can get consistent, then you can begin to optimize from there and
That's
get
right.
into the little nuances.
Yeah, it's all about making things be an easy habit, and then you can do the next step, is what I find. And what I really want to emphasize is that these baby steps add up so much with health. It's like this sort of what I call like a positive snowball effect.
Yeah.
I mean, if you're taking out bad fats and, when I say that, I mean like these industrial seed oils like soybean oil and corn oil and peanut oil and, the canola oil. Like when you're eating healthy fats, you get this oil change, in a few months, your brain is made out of different fats. And this is really impactful in the level of inflammation in your body. So, these things add up and then, they become easy once you've been doing it for a while. Now you can make the next step.
Yeah. And do you support, I mean, is that part of your practice is really supporting people in habit change? Or is that something that is outside of what you guys do?
No, we build into our program health coaching. I think it's critical for success. People need to be able to have someone that they can discuss this with. And, it's a level of accountability and not like we're policing people, but, we all just do better when we know we're going to talk about it again next week with so-and-so. You just know you're going to try harder. And to problem solve with and not feel alone. I think that's very, very important. And I do feel like as much as this is now, like you say, in the zeitgeist, like it's still very easy to feel like you're alone in doing this. So, when you're the only one in your family making this change, you're setting the example. You need support. So that's how we support habit change, is that coaching and accountability.
So coaching is in addition to your program, like you hire health coaches or you have health coaches as a part of your program?
Yeah, I have a nutritionist and health coach in my practice, and I have also a brain retraining coach
I love
working on mindset. I think it's all very, very important for success.
I agree. I agree because it's like you're only as good as your ability to implement these habits. Like I think a lot of us know what the right things are to do. And part of us are all gung ho to do it. And then on a random Tuesday, the other part of us shows up and wants to like drink wine and eat pizza.
Yeah, that's so true. And I think that that's part of when you make a commitment to do a program that just really helps you say yes to yourself and to now you're like, okay, I'm doing it. I've got skin in the game. And then you see the results.
Yeah. And the why behind all of this is like, we really can live a better lifespan and health span. Like people don't have to die these premature or agonizing deaths. Like if we make these changes now, we really can have quite the aging process.
Yeah, that's totally true. I mean, I'm involved in the mastermind about reversing cognitive decline. And I'll tell you, like, these are the things that matter for Alzheimer's prevention. And, in the treatment protocols for people with Alzheimer's, like all these lifestyle parts are critical. And yes, they do the functional medicine work on looking at all the other root causes. But the earlier you can start intervening with this stuff, because, Alzheimer's starts decades before you actually are symptomatic, you can really change your future.
It's so optimistic. So people would come to a functional medicine doctor just the way they would go to a regular internist, I'm imagining, right? I mean, what's a typical patient process with you when they come? Do they come many times a year or as needed, or how does that look?
Yeah, great question. I mean, different practitioners do it differently, but what I have seen the most successful, and I think many, many practitioners would agree with this, is to work in a program. Because, you're not going to, if you just do one-off appointments, then you're going to fall off the wagon. You're not going to make progress. You're not going to, have the structure for success. Like often people will think they don't need health coaching, for example, but they really do.
Yeah.
So it's like the whole shebang is important. If they're coming from the conventional mindset, it's hard because they're expecting their insurance to cover it. They kind of expecting to be given a pill. And, there is a mindset shift that needs to happen, which is like, I'm in charge of my own health. And, is this worth it to me to invest my time and money to change my quality of life now and in the future? When they've made that shift, then they're ready to do the work. And so, different practitioners do this differently, but like we have an initial foundations program that's 6 months. That's how we implement the change. We have testing, we're doing treatments, we have a chance for retesting, and we can start to see like a lot of change, and we can get ideas about better information about what are the maybe longer term pieces that will need additional work. Because, people don't end up where they are overnight. That's the other thing people don't realize. Like, there was the stage set often for decades beforehand. So, there's a lot to untangle, but you can get a lot of movement quickly on symptoms. But to get like the real health restoration and really reduce future risk, you want to try to keep getting at all those root causes.
Yeah. So the way you work is that you have a program that people join.
Yes.
And does
right.
insurance cover any of this, or is this like this is like a out-of-pocket investment?
It's out-of-pocket investment. For people with a PPO insurance, sometimes they can submit what we call a super bill and get some partial reimbursement. But it's not the best way to plan on it. It's really a matter of deciding whether or not it's important for you and your life.
Yeah. Wow. I'm hoping that this becomes more available to people and kind of the norm rather than the exception of how we practice medicine in this country. I'm not sure that's going to be true.
Yeah, we've got an uphill battle, but there are some centers like Cleveland Clinic, for example, has a Center for Functional Medicine where they are doing studies on this approach to show insurers and the public that actually this saves money ultimately. It's worth it. And like Dr. Terry Walls is doing fabulous research on this approach for multiple sclerosis, and Dr. Bredesen on neurodegenerative disease, Alzheimer's. And I'm hoping that over time, the research outcomes really speak for themselves, that this is worthwhile, that we invest in our health now so that we can, not spend most of the money at the last 3 months of life, which is what we do currently in medicine.
Yeah. And just from a cynical perspective, do you think that it's going to be accelerated due to the fact that there isn't a ton of money in healthy eating, right? I mean, we can't the way we can sell a treatment for high blood pressure, high cholesterol, it's, pharmaceutical. It's not quite the same, is it?
No, it's a real uphill battle because the pharmaceutical interest is huge. And same with like the farm lobby, the subsidized grains that are in the processed foods and the oils are made out of. I mean, it's not easy, but it's going to come, I think, grassroots from people really fed up and caring about their health and wanting something different. That's the only way I see it happening.
Yeah, no, I think that people are getting there. I think I still see so much confusion in my office, like of where do I begin? Who can help me? Who's going to give me good answers? And I think that there's just not enough practitioners giving that kind of service out there.
No, and I mean, I think because of the flaws in a conventional medical training, these are the people you turn to normally, your primary care doctor, but they get in my medical school, we had 6 weeks of nutrition education, and that was actually pretty good compared to most schools. And it didn't cover anything about what people are actually facing. It was about extremes of vitamin deficiencies, historically. Like if you don't have
rickets.
Any vitamins,
that's what I was going to say
anymore. I was going to say no vitamin D, you get rickets, for example, or beriberi, or these other obscure things now that aren't in our society. And
Yeah.
yet, years of vitamin D deficiency that is suboptimal actually does really matter, and that's a total crisis in our country. Most people are low in vitamin D. And yet,
Yeah.
yeah, we're not dealing with rickets. It's not that low. So these are they're ill-equipped to guide people on this. And it's unfortunate. And, I could talk for a long time about the problems with the USDA being the people to recommend what we eat. I mean, why does that
Yeah.
even make sense? Right? Like, why isn't it even like the FDA? That makes no sense to me. And, the food pyramid was disastrous. And there's a great story on how that even came to be and how flawed that was. But I mean, the idea of eating like 9 to 12 servings of grains a day, like that just made everybody sicker, so, there's a lot of problems with the conventional information out there.
Yeah. And so the message is to everybody, begin to educate yourself on what's out there in terms of what really is real health, real vibrant health, and how to heal. Because I think there's more information than ever if you want to go find it.
That's right. That's true.
So just to recap for our listener, our average listener is a middle-aged woman, probably late 40s, early 50s. I know because I talk to them constantly that they are very concerned about their health. Mm-hmm. And honestly, body composition. I mean, women in their weight, it's never going to end the battle.
No, and I mean, I'm right in there in that age group, and that's all my girlfriends, so I get it.
Yeah, you hear about it,
Mm-hmm, mm-hmm.
Just give our listener the once over. Like, if they want to start moving the oil tanker of their health in the right direction, what do you start with? Like, just to recap, what you would recommend to any woman in this age group?
Well, we already talked about anti-inflammatory diet, and there's lots of great resources on that. It's hard to go wrong if you're just looking for anti-inflammatory diet and you
look that
pick like
up.
an omnivore approach. I think you're going to be very safe. Beyond that, though, I think there's some key supplementation that people can do on their own that will make a difference. So I'll just hit, a few of those points. One would be magnesium. Most people are low in magnesium for a number of reasons. And that's a huge one that makes a difference in anxiety, in sleep quality. It helps with detoxification. It's needed for energy production. So it's just vital. And there's a lot of forms. And the main thing is an absorbable form. So not magnesium oxide. The rest of them are fine. Some are going to be a little more laxative than others. So you can choose based on how your gut's working. But magnesium, really helpful. Omega-3 fats, if you're not eating fish often, like 4 times a week, and it's not a high omega-3 type of fish like salmon or sardines, then you'll want to supplement with a high quality fish oil that's high in omega-3s. Okay. That is huge for inflammation. The next thing I would say is B vitamins, making sure you're getting activated B vitamins. Now, you get a lot of B vitamins from meat, and also you get folate, which is a B vitamin, from dark leafy greens. But, if you're not getting enough, and that's a lot of people, they benefit from some additional supplementation there. So B complex or a multivitamin with a good amount of Bs in it. And then the last thing I'd say is zinc. Zinc is another one that lots of people, especially with mental health issues, are low in. Okay. And making sure you're getting enough of that. So right there, those simple things added to the diet can make a big difference.
Okay. So even if, you don't even know if you're low in them or anything, but it's just a pretty good bet that those are baseline supplementations that most people can do.
You need to be careful with things like zinc, that you're not supplementing at a high dose, for a long time without any kind of monitoring. But yes, in general, like a multivitamin is not going to be a high dose. And it can be, if you get a good quality one, it's going to have those activated B vitamins in it. They won't have the magnesium, so you have to take that separately. And the omega-3s also, they're just too big to pack into those. So
Yeah. Okay, so those are some basic supplementation. And then where do we go from there? What else are obviously sleep. And sleep is sometimes hard to come by at this age. So, any best practices there?
The sleep hygiene concepts are very important. So reducing screen exposure, light, being aware of the light exposure the couple hours before you go to bed. You can wear, light, blue light blocking glasses for a few hours. That can really
You mean
help
you shouldn't
sleep.
Scroll your phone for an hour before you go to bed?
I know, and everyone does it. And I've been guilty of that too, but it does impair your quality of sleep. And then, sleeping in a cold, dark room is important.
Yeah.
Managing stress, as you know, I mean, it's so critical. When people are really struggling with the thoughts before bed, I like to have them journal it out and get it on paper so they don't have to keep trying to hold it in their brain for sleep. And, getting light in the morning, daylight in the morning that tells your brain, hey, this is morning, because that clock gets set every day. So, you need the right light exposure to help manage that, and getting movement, getting, exercise, but also just movement, walking, standing up, sitting down, like not the same position all the time. This is really important too.
Yeah, we had Vonda Wright on the podcast, and
So
she's,
cool.
she's at the forefront of the whole movement and the lifting heavy at this age.
I love that. That's what I do. I'm a huge fan of
Yeah.
lifting weights. It's fun. I never used to think that, but I think she's right on with that. I think you get a lot of benefits, not just for your bones, for your brain, for your inflammation. It's just really great.
For your metabolic health, right? I mean,
yeah, which drives so
everything.
much.
Yeah, so much. So lifting heavy, move, if it's just walking, that's great. Just a walking habit.
Well, because I think of them separately, exercise and movement. Exercise is like, I go to the gym and I do my, my lifting workout, or, I do kind of like a CrossFit style workout at a gym with people I just love. And that's my thing that I do, 2 to 3 times a week. But the other days, what am I doing just for movement? So yes, a walking habit, stretching, other things, because you need both.
Yeah, just not sitting all day, like getting up, moving. Yeah, I totally agree. Yeah, I haven't ever thought about it that way, exercise and movement being different. I kind of lumping them together, but you're right. We have to just keep moving.
You don't want to be like a weekend warrior where you only just do super intense exercise in the weekend and then you're not moving all week. That's still very problematic. You want to be moving. Yeah, and I think there's more and more things that you don't necessarily even have to work with a practitioner, where there's, like, for example, I have an online course for this natural mood solution looking at overlooked causes. And I teach people how to do this kind of thing. It's like you don't have to, there's so much you can do before you see a practitioner that's worth doing. And yes, there may be pieces that you need a practitioner to unravel, but you can make a lot of progress by doing some fundamental things on your own.
I love that you said that. I think that's so true. So tell us about your program and tell us where people can find you if they want to get in contact with you.
Yeah, I'm on Instagram at Dr. Tracy McCarthy. That's DrTracy McCarthy. And
we'll put all this in the show notes.
Yeah. My website is drtracymccarthy.com for for people who want to be patients who live in California. I can see people in California. But my online program, the Natural Mood Solution, is for anyone, anywhere. It's educational. It's not medical advice. The best way to start learning about that is to download my free guide on the top 10 overlooked causes of brain fog, depression, anxiety. That's at drtracymccarthy.com/top10, TOP10. And that's just to get you started thinking about, hey, maybe this is a piece of my puzzle. Maybe this is a piece of my puzzle. So
I love that. I will be downloading that. Just even for my own clients, because I think that I want to make sure that I'm thinking about all of the things that could be going on.
That's just what I hope people will do, is recognize there's these other pieces of the puzzle. They're really worth looking at. They can make all the difference.
Yeah. Well, thank you so much. I think that this is a topic that women have an endless appetite for hearing about and are so curious about in their own lives. And I think that the big takeaway for me, as always, is just start on this journey. Just start making changes. Like Rome was not built in a day. Start eating real food, start moving, and you will slowly get there over time, because any sort of intervention on this front can really add up.
That is exactly what I see every day. The baby steps add up to tremendous changes in health.
Yeah. Well, thank you so much for being here. I think people will get so much out of this. And I'm really happy you're doing this work.
Well, thank you. And it was a real pleasure to be here.
Thanks so much for listening today. As always, we want to hear from you, what you're interested in, what you're struggling with. So drop us a line at info@insightsfromthecouch.org. Also, head over to our website, insightsfromthecouch.org, to get the download that goes with this episode. If you like what you heard, and we hope that you did, don't forget to subscribe, share with a friend, or write a review. All of this helps get our message out. Thanks, guys. We will see you next time, and Colette will be back. Take care.